Welcome back to Houston Life. You know, the entire city, of course, is getting excited for tonight's big game, the ALCS Game 1. And we know how to support our hometown team. Take a look at this photo. These are Memorial Hermann employees from Memorial Hermann Greater Heights Hospital, and they are showing their Astros spirit today, like everybody. But we love to see our emergency workers doing that as well, and happy to give them a shout out. Speaking of Memorial Hermann, for your health, between work schedules, the kids, their activities, you know, us moms, we're all so busy, and sometimes our own needs go to the side, and keeping up with our own doctor's appointments and health screenings can be a real struggle. It's something that maybe we'll say, I'll do it tomorrow or next week. Joining us now with why it's important to women to prioritize their own health and wellness, we have Dr. Anisha Varishta, who is an OB/GYN with Memorial Hermann Sugar Land. It is so great to see you.
Thank you for having me.
Absolutely. We appreciate you being here. This is such a great topic. I'm so glad we're having this conversation today. So many of us women, we get busy and we're like, we're going to schedule that. Let's talk about the health screenings that women should complete regularly and what the age requirements are for some of those.
Exactly. So definitely, you know, visiting your physician yearly, either it be a primary care doctor or an OB/GYN, is so important to maintain your health. When you see us, you know, there's things that we can pick up in terms of blood pressure screening, cervical cancer screening, you know, mammograms, colonoscopies. These are all age-specific guidelines that have been set, and so it's important to meet with us regularly to kind of know, you know, when are these things due, and you know, when I should come back and to follow up.
Right, and right now on the screen we're looking at some of the age requirements.
Exactly.
Of course, Pap smear starting at 21.
Yep.
And then those mammograms and
at
everything
40.
follows.
Yep, exactly. It's Breast Cancer Awareness Month, so mammograms every year starting 40. Colonoscopies now have decreased from 50 to 45 because we noticed when we started them at 50, we were missing cancers. And so now the newest recommendations are start your colonoscopies at 45, and then the bone screen, the DEXA scans are at 65, but most women will have other risk factors, and for that they need to visit their PCPs, their OB/GYNs to see, hey, do I need to get screened earlier? Do I need to catch this early, treat it early? Things like that.
You know, even if you're not falling into one of those age requirements, the general physical is a great baseline. You know, I just went through that and did a blood pressure monitoring because some things were wacky and it ended up being great. But here's the thing, knowledge is power when we're talking about these screenings.
So yeah, definitely come visit us. When you see us, you know, oftentimes it's just a time for you to discuss your concerns. What are you worried about? What are your new stressors? What family history do you have? What should we be looking out for, right? So a yearly visit is so paramount to prioritizing your health. And so, you know, it's easy to get bogged down with life and kids and gastros, you know, everything. But you need to stick around. You know, there's lots of people that are counting on you, and so it's important to come see us to make sure that we can help you get, you know, a long, healthy life.
Absolutely. Okay, let's talk about prenatal and postpartum care. So important, obviously, to expectant mothers. I had both of my boys in the Memorial Hermann hospital system. Amazing experiences, but I'm sure so much has changed over the years, and let's talk about that.
I mean, they're still doing an amazing job supporting their moms, right? And so coming to see us early and often is important to catch any complications, address any concerns that you have, making sure that both mom's well-being and baby's well-being are being taken care of. With the COVID pandemic, I feel like so many of us are isolated, and all of that support that we gave to our moms prenatally and postpartum, some of it has dwindled away, but coming to see us allows us to be your support person. Let your OB/GYN, let Memorial Hermann be there for you to make sure that we carry you through your pregnancy and after.
That is so good. And what are some of the ways that you and your team support pregnant moms? Because there are some really great things going within the system.
So the Women's Health Services do an amazing job. We have lactation consultants that are there in the hospital. There's prenatal classes, there's maternity tours, there's sibling classes, there's breastfeeding classes. You know, you do all of this prep throughout your pregnancy, which is important, but then ultimately even in the hospital, there is so much staff to support you. There's 24-hour-a-day lactation services, there's pelvic floor physical therapy, because, you know, only you and I know and all the other women know what kiddos can do to our bodies, and so we need that support even after delivery, and it's there. You just come see us so that we can offer it to you, when you need it most.
Ask those questions to your doctor and keep that line of communication open, because they can give you the answers and have the plan to move forward. Dr. Anisha Farishta, thanks so much for coming in. Go Stros.
Go Stros.
We appreciate all the hard work that you're doing at Memorial Hermann Sugarland.
Thank you so
Great
much.
information
Of
today.
course.
To learn more about women's services offered at Memorial Hermann, just head to their online website, memorialhermann.org/women, or you can give them a call at 713-222-2273.